मेरा नाम डॉक्टर साजिद मजीद है। मैं कंसल्टेंट चाइल्ड स्पेशलिस्ट हूँ अजीज़ भट्टी शहीद हॉस्पिटल गुजरात में। टुडे आई विल टेल यू हाउ टू अप्रोच ए डेवलपमेंटली delayed child and what should be the differential. Whenever you see the developmentally delayed child less than 5 year, always make three differential: cerebral palsy, post meningitic sequelae, or patient having the torch infection. Your quant will be the parents are concerned about 3-year-old child who is not holding his neck. सबसे पहले आप अपने आप को इंट्रोड्यूस करवाएं। जैसे मेरा नाम डॉक्टर साजिद है, मैं आपके बच्चे का मुआयना करूंगा जिससे आपके बच्चे की बीमारी में बेहतर तशख़ीस मुमकिन होगी। फिर बच्चे को एक्सपोज करें। द बेस्ट एक्सपोजर वुड बी द मिड चेस्ट टू मिड थाई। फिर हैंड शुड बी स्ट्रेट, आर्म शुड असाइड एंड लेग शुड बी इन वन प्लेन। जब आप पोजीशन बना रहे होंगे आपको उस वक्त रिजिडिटी, फ्लैसिडिटी और नॉर्मल टोन का पता चल जाएगा और ये क्लू होगा आपके लिए। बच्चे को ऑब्ज़र्व करने 20 सेकंड के लिए देखें बच्चे ने एनजी तो नहीं पास हुई बच्चे को फोलिस तो नहीं है या कैनोला किस हैंड के ऊपर है। लुक एट द हेड साइज केयरफुली फॉर माइक्रोकेफली, then look for the posture, either the patient having the fisting, then also carefully look towards the eyes. If the patient having the slow gaze, it is always due to the cerebral palsy. If the patient having squint, it can be due to the postmeningeal sequelae or can be due to the cerebral palsy. Observe for the abnormal movement. Suppose if you found the chorioathetoid movement, this can be found in one of the type of the cerebral palsy, but don't think about the degenerative brain disorder like Wilson or rheumatic chorea, or as the Wilson mostly present after 5 year and rheumatic chorea after 6 year. If possible, ask about the gait. Can he walk? Yes. If the patient can walk, then look for the tiptoe walking or dragging one side. If he cannot walk, is the child is quadriplegic or diplegic? Then this will be your assessment. Then start from hand. Is the child having the pallor, clubbing, or there is any sign of nutritional deprivation? Take pulse for 6 seconds, normal or low volume. Also try to count the respiratory rate for 6 seconds. Check BCG score. Then if possible do the height and weight at the same time. As in case of cerebral palsy, patient cannot stand, so you can take the length of the child, though it is not recommended after 2 years. But in case of cerebral palsy, you can take the length of the child. Then take head circumference for anterior and check the anterior and posterior fontanelle. Check for head lag. If head lag is present, this is a very informative clue for you, as head lag is present in case of the developmentally delayed child. Then do the examination of eyes for cataract, which can be present in case of torch, and also check for the squint, which would be present in case of postmeningeal sequelae or cerebral palsy. Check the oral hygiene, check for drooling of saliva, dental caries, and oral thrush. Do the low limb examination. In case of cerebral palsy, tone will be increased, power will be 2 to 3 by 5, reflexes will be increased, Babinski will be increased, and bulb will be decreased or normal as in case of disuse atrophy. While in case of hypotonic CP, the tone can be decreased, power will be 2 to 3 by over 5, reflexes can be increased and Babinski decrease, and bulk can also be decreased in this case. Same time examine back for bed sore or any meningomyelocele. Also look for any complication like contracture or scars is present. Apart both leg. If both legs will be apart easily, it can be the case of postmeningeal sequelae. Otherwise, it would be the cerebral palsy in which their contracture has been developed. Then check for the upper limb, and if the patient is quadriplegic, there will be increased tone power will be decreased and reflexes will be increased. While if the child is paraplegic or diplegic, you can find the normal finding in the upper limb. Do the examination of the abdomen for the liver and blueberry muffin spots, which are suggestive of the torch. Uh, do the examination of the chest for aspiration, and for cardiac involvement, look for the as present in case of the torch. A heart is less likely involved in cerebral palsy and post meningitic sequelae. Then do the developmental age of the child. Check each component of the developmental age. इसमें बच्चे की ना एवरेज डेवलपमेंटल एज निकालनी होती है। बच्चे का ग्रास मोटर, फाइन मोटर, हेयरिंग, विजन, स्पीच और सोशल चेक करना होता है। ग्रास मोटर में हमने चेक करना होता है बच्चा नेक होल्ड करता है या सिटिंग अचीव किया है। फाइन मोटर में अल्नर ग्रेस्प है, पामर है, इंटरफ्लिंजर है या फाइन ग्रेस्प है। हेयरिंग, अगर बच्चा ईयर के लेवल के ऊपर सुन रहा है तो 3 मंथ का है, अगर बिलो एंड बिहाइंड सुन सकता है तो ये 6 मंथ है। विजन में आप देख सकते हैं बच्चा फिक्स एंड फॉलो करता है एट 45 डिग्री, विच इज़ सजेस्टिव ऑफ न्यू बॉर्न। 90 डिग्री के ऊपर 1.5 मंथ और 180 डिग्री के ऊपर 3 मंथ तक बच्चा देख सकता है। सोशल में स्ट्रेंजर एंग्जाइटी, स्पीकिंग में बच्चा मम मम डट डट या मामा कहता है। इफ़ द डेवलपमेंटल एज इज़ लेस दैन 6 मंथ और 1 year, then do the neonatal flexes. Then you describe the examination, and description of the short case would be very brief and concise. That you would describe the general physical examination, then important positive, then important negative, and then rest of the examination is normal. Like a 4-year-old child lying down, quite irritable during my examination, having cannula on the right hand. Patient is obviously having microcephaly with head circumference of 43 centimeter with slow gaze, having respiratory rate of 30 per minute and pulse rate of the 110 per minute. During motor examination, patient is unable to walk, having upper motor neuron type of lesion with increased tone power 2 by 5 with hyperreflexia and upgoing plantar in upper limb. The patient having the increased tone, increased reflexes with power of 2 by 5. Rest of my examination is like cataract, blueberry muffin spots, patosplenomegaly was not significant. On basis of my examination, my differential of cerebral palsy, post-meningitic sequelae, or torch infection. There are some specific and some supportive investigation. Name all the investigation like MRI, torch screening, blood complete picture, urinary and chest X-ray. Then if he asks about any specific investigation, then describe. Like in case of MRI, in having calcification and hydrocephalus. In case of torch, in case of cerebral palsy, there is periventricular leukomalacia or subcortical gliosis. In case of post meningitic sequelae, there will be brain atrophy and hydrocephalus.